Today we will discuss about blood clotting. So basic theory, more than 50 important substances that can cause or affect the blood coagulation. There are procoagulants and anticoagulants in our body. The balance between these group of substances will decide whether the blood will clot or not. In the bloodstream, usually anticoagulants predominates so that the blood does not coagulate while it is circulating inside the blood vessels. But when a vessel is ruptured, procoagulants from that area of the tissue damage become activated and override the anticoagulants, and then a clot will develop. So there are generally three mechanisms of blood clotting. So first one is activation of prothrombin activator, and second step is the prothrombin activator catalyzer converts prothrombin into thrombin. So second step is conversion of prothrombin into thrombin, and third step is conversion of fibrinogen into fibrin. So let's discuss about the conversion, how the conversion of prothrombin into thrombin occurs. First, prothrombin activator is formed as a result of rupture of the blood vessel. Second, the prothrombin activator in the presence of sufficient amounts of calcium plus ions causes conversion of prothrombin into thrombin. So it could be a enzyme which is converting the prothrombin into thrombin. It could be a prothrombinase. Okay, and conversion of prothrombin into thrombin. Prothrombin is a plasma protein. It is usually present in a normal plasma in a concentration of about 15 milligrams per deciliter. It is the unstable protein that can split easily into smaller compounds. Which of some of these components, the smaller components, are thrombin? So usually prothrombin is a plasma protein. It is present in a normal plasma. When prothrombin activator activates the prothrombin, prothrombin is converted into a thrombin. Prothrombin is usually formed continuously by a liver, and it is continuously being used throughout the body for blood clotting. If the liver fails to produce prothrombin in a day, the prothrombin concentration in the plasma falls too low to provide the normal blood coagulation. So vitamin K is necessary for the synthesis of these blood clotting factors for the blood clotting. So third step is conversion of fibrinogen to fibrin. Formation of the clot. This third step is the formation of the clot. Fibrinogen is the high molecular weight protein that it is also circulates in the plasma in a concentrations of 100 to 700 milligrams per deciliter. So even in this liver diseases, even fibrinogen synthesis also decreased in the liver. So chemical clotting is usually described in the three simple steps. Stage 1 begins when a vessel is cut or damaged internally. The stage 1 prothrombin activator, which may be also known as prothrombinase, this activates the prothrombin, then prothrombin converts into thrombin. So the whatever the thrombin brings about the third stage reaction, converting fibrinogen into fibrin. The clot itself is made up of fibrin, the product of stage 3, and fibrin is thread-like protein. So many strands of fibrin form a mesh that traps out RBC and platelets and creates a wall across the break in the vessel. So let's see what is hemophilia. There is several forms of hemophilia, or are genetic and characterized by the inability of the blood to clot properly. So these are the chemical clotting factors. These are the factors needed, and this is the reaction in stage 3. These are the factors needed, and this is the reaction happening, and this is the diagram of how the blood clot is formed.